So I figure we'll do a quick round of intros and then we can dive into sort of like Tiny Health, sort of who we are and our reports and things like that. So I'm Cheryl, I'm the founder and CEO of Tiny Health. And we have Taylor here. You want to quickly introduce yourself?
Hi, I'm Taylor. I'm the medical director with Tiny Health. I guess not too recently now, but it feels really recent, joined Tiny Health from the conventional medicine world where I was training in pediatrics. And I've done some research in the infant gut microbiome and made the transition because I believe so deeply, as I think we all do, in the mission of what Tiny Health does.
Yeah, and Taylor's been fantastic. And then we have Donald here, who's our chief of staff.
Hey, my name's Donald. I'm chief of staff, like Cheryl mentioned. I also lead the product and tech team. So I'm just here as like a fly on the wall in case, there are things that we eventually decide to build to make it a little bit easier for you guys. So just here to listen mostly.
Yeah, we're thinking of a practitioner portal, so it makes it easier for you guys to log in to see patient or client reports. So yeah, I'll do a quick intro on Tiny Health as well. So I started the company about a couple of years ago, as I mentioned, a month after Taylor was born, my son. He's my second born. My firstborn, Charlie, who's a girl, gender neutral names, was born about 4.5 years ago through a C-section. So I had started my research in gut health when I knew she was breached and may have a high likelihood of being born by a C-section. I ended up learning a lot about how the baby gets seeded with the mom's vaginal and gut microbes during birth, and therefore didn't want to do an elective C-section and opted for, to labor and even try to birth her vaginally when she was breached, but, ended up with a C-section anyway. But, did all I could to sort of like ensure that she still had the best seeding and did a vaginal swabbing protocol. And then also throughout her year and a half, breastfed her because I learned that could kind of de-risk her atopic march risk, and gave her a lot of probiotics and yogurts and things like that. I found a paper that by year one, there's babies who are born with a C-section signature. By year one, if that signature is gone, her risk for asthma would have been reduced by a factor of 4x. And so she unfortunately ended up getting some eczema, but it was mild. So I think all my efforts sort of paid off. I was looking for a baby gut test that, could find the microbes that were essential for immune health, as I learned, but I couldn't find one. It was all adult tests. And also I wanted to find like a metagenomics based test, not a PCR based test, because PCR based tests like your Genova map or GI map that you may be familiar with are only measuring a very specific set of microbes and may not be measuring microbes that I knew was important for my baby's health. So I was like, okay, there's just no test out there for babies her age. And anyway, then when I was pregnant with my child, I learned that, maybe I was missing the microbes that I'm supposed to pass on to my baby. So even through a vaginal birth, if I was missing them, then it wouldn't help. So then I was looking for a test for me during pregnancy and couldn't find one. I found a metagenomics test. I think I took longevity at a time. It was like $4.99. It was a crazy price, but I paid for it. And then I also took day 2, which is now, it used to be more like a diabetes patient test. And now they've closed it to offer it only to B2B, but it was also like $3.99. I really wanted to find if I had B. infantis, Bifidobacteria infantis. So yeah, and I ended up realizing through those tests that I had very little of. So when my son was born, this time through a vaginal birth at home, I decided, I wish I had my test earlier, but I decided to give him B. infantis for 3 weeks when he was born. And I started the company a month after he was born. So, so that's kind of a brief history of kind of how I started the company. And yeah, Taylor's just flashing sort of like the differences between the various tests. Just curious if you guys want to, like, have you guys done other gut tests, used other gut tests before? Like GI map or GI effects, or is this the first gut test you are encountering at Tiny Health?
I had reached out to Dr. Trill about a gut health test that I had found. And then she actually recommended you as being one that she preferred more, which is how I ended up finding out about you.
Got it. Yeah. And so you've never done other gut tests before for your client?
No, I've heard a little bit about them in the hospital. You know, we deal with C. diff and stuff, and there are families that get gut health tests and then they're, you know, like reseeded, like stool exchange. Other than that, I really don't know a ton about it. I'm reading and learning kind of alongside of everything. And then my career path changed. And so now I'm dealing primarily with infants. And I'm just finding that my practice would be so much better well served having understand this a lot more, and then having the tools to be able to help families be able to figure out what uniquely they have. So that's kind of why I'm here. But
yeah,
it's neat because there's so much more to it. And people ask me like, well, what can I do? And it's like, well, the research is so new and emerging that it just seems like I don't know where to go and trust. And I really love Dr. Trill. And so I'm just like here just to learn as much as I can and figure out how I can use Tiny Health in my practice to make it so we can help those families that have eczema or that, you know, are dealing with, I mean, there's just so much involved in seeding that I feel like I know enough to hurt myself sort of thing. And so, yeah, to answer your question, no, I don't really know a ton about it. I definitely know that it's existed for adults, maybe in the realm of certain things for a little while, but I love to see that this is something that we're talking about, especially when you're talking about like women's health and babies' health, because I think so often women or people want to, we already bear so much burden and like guilt for things that happen that this is kind of a way to heal that too when you look at it, because sometimes it's like, you know, you don't want to say to a mom like, oh well, it's because you had a C-section, like, because that's not fair. And so I think this is a way to go, and because of these things that happened, we can benefit your health and your baby's health through knowing all of this stuff about your own microbiome, and that gives them empowerment. And I think that's really one of the reasons why I love this is it's a solution to all these other problems that I'm facing with women and on an emotional scale as well.
Yeah, I know it's hard to thread, like, thanks for sharing, by the way. It's like hard to thread that kind of like, well, the science says that a C-section born baby, formula-fed baby technically has a less ideal gut microbiome, and we certainly show that in our we can see that in our tests. But you know, that's not the angle we necessarily have to come at with the parent or the mom, right? Because to your point, it is empowering, and the reason why I started this company, and also I've been through a C-section and I was formula fed too, is that there is something you can do about it, right? It's not like a genetic test that you take during pregnancy and you're like, oh, I have, you know, my baby has these genetic defects. With the microbiome, you can truly change it. So even with antibiotics and C-section, there is a way to remove that C-section signature by 1 year old. I think the key here is to do kind of early detection and to be aware of it, and not, you know, sort of, it's not like a blaming game, but it's sort of like, well, let's see what is going on with your baby's gut, and let's see what we can do about it to improve it. I'm curious to hear, so thanks for sharing, Sarah. I would love to hear from Kiara and Nora too, if you don't mind sharing.
Yeah, so just a background for those of you who don't know me, I'm a pediatric pelvic health occupational therapist, and I work with children who have bowel and bladder dysfunction and toileting issues. And so a lot of the children that I'm seeing in my practice have difficulties with their gut health. It's just apparent. I would say 100% of my patients do. I own a boutique practice in the Northern California area. I was trained at Stanford Children's Hospital. I've been a therapist for over 13 years. And in this specialty area of practice, there are not enough assessments or measurements for gut health in children. And that's why I was like, when I found Tiny Health, I was like, I need to reach out to these people, because parents are wanting answers to what's happening when their child is demonstrating bladder dysfunction. So think of potty training, there's issues around that. Constipation is huge. bedwetting, all these things are actually connected to the microbiome. And I work closely in collaboration with functional medicine pediatricians and other naturopathic doctors. And they do some of these tests, the gut testing. But the conventional medicine docs are not offering this to some of the patients. So that's why I think it's really important to, number one, be relevant in what's happening with research, but also to finding the newest kind of information out there to support these families, to find answers, and to overall, like my goal is to support that child throughout their whole childhood, and then it carries on to adulthood. Because when children are displaying these pelvic floor issues early in life, they are the ones who are in pelvic health as adults. And so there's just that whole piece that I think is missing from kind of the pediatric side of it.
Mhm. That's great. Thank you.
Yeah, Kiara, that is really, it's, having worked in pediatrics as well, it's the work you're doing is so amazing. I actually hadn't really, before I started reading about the work you do, seen anybody doing this type of work. I do think it's so important. It's really an incredible sort of niche that you've started, a gap that you started to fill.
Thank you so much, Taylor. And I will say too, that some of the children, I am the last person they see, right? The parents are like, I don't know what else to do. I've been to 101 specialists. I've been to GI, urology, psych, you name it. I've done it all. And then we work through it. And most of the time we can figure it out. But then there's this piece that that you guys are talking about that sometimes is the missing link that I'm not an expert at, right? I don't know. I'm not a microbiologist. I don't know, gut health intimately. And so I think this would be a wonderful offering for those families that are like, okay, we just need to dig a little bit deeper and be more curious as to what exactly is happening with this child's maybe gut motility because of microbiome imbalances.
Yeah, absolutely.
Nora, I would love to hear from you.
Hi. Yeah, so I work with parents of kids who have eczema. And I have 3 kids, 2 of whom had really, really severe eczema as kids. And I think the thing that really took me down the road to gut health was realizing that it wasn't a skin issue. My son had so many food sensitivities and GI issues and, stool issues. So that was the first thing that got me down this road. And it's funny that you mentioned that you offer a more economically priced test, because I have noticed that so many other lab tests, parents find it to be more expensive and unaffordable and not very.
Have you done the GI maps or GI effects for them?
So the only other lab that I'm currently working with is Equilife.
Okay, I haven't heard of that one.
Yeah, with Dr. Stephen Cabral.
What kind? Do you know what technology they use?
I'm pretty sure it's a PCR test.
PCR. Okay.
Just like you said.
Yeah. So, and you're aware of like PCR is only measuring a very subset of microbes, and that's kind of like a physician ordered. If you go to a hospital, a GI doctor would order that test, or a functional doctor typically, just because. And it's not like it's bad or anything like that. It's actually PCR is an improvement from, I think, it's similar to culturing, but sort of better. And then 16S is an improvement over PCR, and the metagenomics really is the kind of the gold standard in microbiome research now, where we have strain level resolution and we profile the entire ecosystem of the gut or the vaginal microbiome, so that we really know if we detected like C. diff or E. coli or Klebsiella, is it, with PCR, like its detection or not? We don't really know what percentage of the community. So with our tests, as Taylor's kind of flashing the portal.
Just want to make sure it was still up.
It's okay, you can flash the portal and you can go to the microbiome section, and we wanted to show you how our report works. We profile say 100% of the child's gut or the mom's gut or the dad, we do all kinds of even adult testing. So, if the C. diff is really just 0.001% or is it 1%, it makes a huge difference to know the kind of abundance, the relative abundance in the community to really see if it's an overabundant issue or is it within range in the specific age group, because the 0 to 6, and then when they start solids, it's different. And then 1 to 2 to 3, it's kind of like the reference ranges changes. And then by the time a baby's 3 to 5, their guts are like an adult. And we see it, when we compare the 3-year-old gut to an adult gut, like their mom or dad, literally looks similar, so similar we can't distinguish that it's a child's gut. However, and then we get this question a lot, is it too late now that my child's like 4 years old to come test? I think this is one thing I wanted to clear up too, is even though the child's gut is more mature, which really means that earlier signatures like eczema or food allergies or the microbes associated with those conditions, constipation even, are less clear when the gut is mature. And the reason for that is because, as you think about it, when more solids are involved, the child's eating a much more complex diet compared to breast milk or formula in early life, where their diet is just really one food, right? It's so simple that their guts are so simple and immature, and it's supposed to be immature and immatures along the way. And when the child's gut is fully mature, it's so complex that the signals are gone in terms of these high Klebsiella. Like, this child at 7 days had a very pro-inflammatory gut that we do see then potentially causing eczema and food allergies and, things like that. Those signals are gone by the time they're 2-3 years old, because if the child's gut remain that inflamed at 3, they are probably having some sort of serious like IBS issue. So you don't typically see that. The signals are lost. But it's still, but the child is still young, and as a parent, you can still influence their guts a lot in terms of diet and lifestyle practices and things like that. So then at 3, we look at different things like fiber digestion, protein, fat digestion, short chain fatty acids production, whether they have an overabundance of Bacteroides fragilis, which is connected to constipation, for example, because that's where now eczema is kind of like less of an issue. It's usually a really big issue in the first year or 2, and then other conditions appear when the child gets older, like constipation and like food sensitivities, lactose intolerance. My daughter now at 4 is having dairy intolerance, so I'm like trying to figure that piece out and learn that it's more genetically connected than microbiome connected for food sensitivity. So that's a different bucket altogether. But yeah.
And if I could just chime in, so I also sort of think like, in our earliest patient kiddos that we are able to sample, that is a great time to be able to provide some of these insights to try and alter the trajectory of the microbiome. But then also when kids and even adults are a little bit older and we are getting to that, adult phase microbiome, which is the only time a 5-year-old gets called an adult. But we want to make sure that even if they had this unfortunate high inflammatory state earlier in life, the second phase is making sure that the gut isn't continuing to trigger inflammation. So we want to make sure that, one, we set them on a good trajectory. Unfortunately, if we miss that phase, we still want to make sure that we're not contributing to any sort of, immune dysregulation or poor immune education that happened early in life. So it can still be helpful. Ideally, we want to do more preventative care, and but we also can help with symptoms by making sure that the gut is a healthy component of the rest of the body. So I really think that this testing is ideal for every single age to make sure that your gut health isn't either establishing or contributing to inflammation. And one thing I wanted to show you guys is, so we pulled up just 3 big picture microbiome breakdowns. Now, this is just one component of the information we provide, and we'll go over into like all the key insights. But, of course, this is, even me working here, as soon as I got my results, the first thing I wanted to know was like, what's my breakdown? And so if we look at this first column, Dashiell, this is one of the kiddos who's been with Tiny Health like since its beginning. And so before there was a lot of recommendations in terms of what recommendations we have in terms of supplements. This was somebody who was, very early on, we were monitoring the early life microbiome. So we can see here, this is a monitoring only sample. And if we go from bottom to top, this is 7 days up through 2 years of life. And we see that 7 days, the gut is dominated by unfriendly bacteria. We don't see any of those beneficial bifidobacteria that really should be dominating the gut. We, of course, want a little bit of these, these little bit of pro-inflammatory microbes because they help educate the immune system early in life, but this is a lot. There's no beneficial in there helping to digest the HMOs and breast milk.
This was a vaginally born, exclusively breastfed baby, exclusively breastfed for 8 months too, which is really shocking, right? And we have the mom's pregnancy and vaginal microbiome too, because this was a research subject. And the mom actually had BIFs, but her vaginal microbiome was disrupted. So we think that has a role to play. So the lactobacillus dominated vaginal microbiome. The lactobacillus doesn't colonize the baby's gut, so we're not going to see it. But we think that because the mom's vaginal microbiome did not have lactobacillus, the BIFs in her, even though the mom had BIFs, it didn't kind of stick in the baby very much for some reason. Still very little data. More research needs to be done in this area. The mom-baby connection is very important. Unfortunately, it is a huge burden on the mom, but it is what the science shows. So this baby, as Taylor pointed out, fortunately at 18 months, 2 years old, I mean, the baby has always had food allergies, intolerances, GI issues, and at 18 months got diagnosed with failure to thrive in terms of height. And so, yeah, it was really interesting. And then the two right examples are Taylor's, the middle one is actually my son. As I mentioned, I gave him 3 weeks of B infantis because I knew that I didn't have it. So I was like, oh no, like, I only gave it to him for 3 weeks, and the probiotic, the B infantis, persisted in his gut. And by 12 months, it was still 90% of his community, which is really crazy. And my breast milk, the HMOs in my breast milk kept feeding that bacteria. So it remained pretty high. And so he's clear of anything. He has no issues, touch wood so far, no eczema, no food allergies, nothing. He's completely clear. And whereas my C-section daughter has a lot of GI symptoms still, despite my efforts. And then ROAC, which is the one on the right, the far right. I mean, there wasn't really much we prescribed because his gut looked decent, like a little bit of red at the beginning, it's fine. And it kind of went down with breastfeeding. And the 5-month one, he was a little bit ill. So you see that reflected. He had fever and I guess maybe a little bit of reaction to the vaccines at his well visit. So we saw that reflected in the gut, which is really interesting. But thankfully at 6 months, he kind of recovered and is back on track. And as the child's gut approaches 1 year old and more solids, you see more of that yellow and unknown microbes coming in because the child's gut is maturing. The BIFs naturally go down a little bit from 90% to maybe 10% or 20 or 10%, and that's normal. So by 1 year, 2 years, you see different microbes taking hold. And so we do kind of like, our test shows you what's sort of like the normal transition in the baby's gut.
Yeah. And one of the things I love about this last sample is that we can see that, some things can transiently change the microbiome. And of course, early in life, this can have profound effects. But if you set kids up for health in a good microbiome community that is strong, even if you have a sort of temporary, if they do need to get antibiotics or, we know vaccines can have a lot of really beneficial effects for long-term health and safety and public health. But, if you have a little bit of a microbe shift, we saw that his bounced right back. So I just love this example of how, when you build a strong community, it can handle some of these sort of hits that it takes just by, being alive. And so, yeah, I just think that that's such a great example.
Yeah, any questions so far before we move on?
Yeah, have you ever seen an example where a child had more beneficial strains but still had eczema?
Yes, but rarely so. Again, I think the timing actually matters a lot for eczema specifically, which I know Sarah and Nora, you focus on. The first, and we're, because we have so much more data now, it seems like the first 3 to 4 months is really quite crucial. Our eczema biomarkers are until 6 months old, but usually kids who have eczema have it between 3 to 6 months, more so 6 months when they start eating solids, right? That's when my daughter had it too. But we see if the gut was inflamed for the first 4 months, it's harder at that point, even when we detect signatures associated with it, to completely reverse it. I think it still is better than not doing anything, because it may stop atopic march, so the umbrella of allergic diseases, from advancing from eczema to food allergy specifically, or asthma in the future. So we think, we may be able to sort of like reduce the symptoms of eczema. We don't know for sure, but that's the hope, right, for what we're working on. But yeah, typically it's interesting that if the baby was born with a lot of, especially Klebsiella, if you want to click into eczema, Taylor, some of these microbes that are very associated with high risk, like Enterobacteriaceae and Klebsiella on the right, some babies are born with 90% of that, right? 99%. And even frankly at 50, 60%, that's pretty high. And if those levels aren't brought down quickly enough, so early detection again, then there is that risk. So early detection and prevention is quite important. Yeah, that's specifically for eczema, but it's all related. What would help most, since it's the 3 of you, what would help? Would it help more for us to walk through the report, like Taylor can walk through each key insight? If you are interested in, like, how do we interpret a baby gut result? You want to click into key insight, Taylor, or would you like to more like share what you're looking for and how you're planning to use Tiny Health for your clients?
Yeah, I can go ahead and share. So first of all, I think just all the things that you've shared so far with the eczema, the food allergies, the asthma, the gut health microbiome, it's every single patient I see. Like, it's amazing. Like what you just presented, I wish I could show every single parent and say, your child has all of this potentially because of this that like has not been assessed. And what I'm looking for specifically is to be able to give them the resource and the information to make educated decisions based on what to do next, right? So you're saying it's a little bit harder once the child becomes older, like 3 or 5, but sometimes these kids are coming to me as infants and parents are saying, my child has constipation, gas is an issue, the baby's colicky, they're not stooling all the time. Why is this happening? And my pediatrician is telling me, oh, it's fine, it's normal. But I have an older child who, either this didn't happen or this did happen, and now we're on the road of having all these issues. And so I see parents both preemptively and also on the other side of it, where it's like, I'm throwing my hands up, I'm almost giving up hope, right? So I would love to be able to, like I said, share this resource for them to do their own testing, because some of the providers, and I would say I see parents from all over the US, but also internationally, but in the US, physicians are not like, yes, let's test your child's gut microbiome. Like, parents have to advocate or go to another provider, and it just is this really tough journey. And by the time they get to someone, it's like $500, and they're like, this doesn't seem realistic. So if it's something that like you guys are offering, which I think is wonderful, that they have that ability for them to do it, gain access to a test, but also get the results and have a plan moving forward, on top of being seen by other complementary practitioners like myself, or a functional medicine doc, et cetera. I think when I see that in patients and when they have that holistic care, kids get better and they just thrive. And so I just am seeing such a wonderful opportunity for my patients to kind of get this service.
Yeah, and I think the affordability aspect of, I don't want to say this is not, it's hundreds of dollars. We are the most affordable, which I think is really great. But I think one of the important things is being able to retest. And if you're doing a $500 test, you can't, the ability to do that multiple times a year can really be cost prohibiting. And I think that, one of the things that we really strive for is encouraging people to retest, because the early life microbiome does change so rapidly. We also want to make sure that if we recommend an action, that we can see, one, is it effective? Or, even the best products, some guts are just like, that one's not for me, thank you. So is it effective? And one, if it is effective, like Cheryl was pointing out, she gave Taylor a B. infantis probiotic for a pretty short amount of time, and it did its job and didn't need to be continued. And so by being in a place where people feel like they can retest, and it's not going to completely break the bank, then they can really stay on top of gut health and actually like be mobile and be flexible in their interventions. And I think that that's such a powerful.
It's really interesting that same probiotic, B. infantis, that this other kid took, and she also did a monthly sampling schedule. The baby's gut, it was only 20% of the baby's gut community in the first year. And even though the mom kept giving him every month, and she bought like a 5-month supply ahead of time, which we wouldn't have recommended, frankly, because it just didn't somehow, maybe the HMOs in her breast milk, and she was breastfeeding exclusively too, it just did not increase that strain. So maybe that strain's tapped out for whatever reason in their own community, right? So then what we would have recommended is to switch to a different probiotic, but the mom didn't want to waste money, already bought the 5-month supply. So we're like, okay, let's just keep at it and see if it increases. It never did. It remained at 20%. It was so interesting, right? So it goes to show that right now when we give infants or kids probiotics, we're kind of flying blind. We don't know if it's working or not. And you may be giving them something that's not really changing anything in their community. And FYI, probiotics are meant to be transient in an adult gut, but in a baby's gut, if there is still breast milk involved or an HMO supplement, it will colonize. It usually does colonize, again, with the caveat of their other community, right? But I think probiotics is one of those, in a way, tools that we leverage to impact the community, especially to push out large amounts of unfriendly bacteria early on. Is very effective at that. But we are not so pro-probiotic that we're like, just give it to any baby. We think that there's a natural rule for their natural strains to kind of take hold. So we're more naturalist in that sense, like, okay, take probiotics in infancy as somewhat of a treatment. Maybe I shouldn't say treatment, not medical advice, but, to really do its function to push out the bad community, and then kind of wean off the probiotic and see how the community sticks around. It should, again, with HMOs, with breastfeeding, either HMOs in breast milk, or there's some infant formula that has it now, or an HMO supplement, right there. And we recommend products in our action plan. It should stick around, right? So if not, then we would recommend switching and trying again, and then stopping and then resampling to see what happened.
And I just have a comment, like, I think that's so great, because a lot of the patients that I'm seeing in my practice, they're just giving, like you said, probiotics like blind. They're hearing, oh, probiotics can help with gut health and constipation. But if they had more of a objective measure, like what you're showing is saying, these are the things that your child is, like deficient in, or that we can really work on this particular type of strain of, probiotic that's more realistic to an outcome that we're hoping could potentially work versus just giving things blind because that's what they're being told. And I think if you're starting early, like preventative wise, and this is what my thought is that you're catching the kids having to end up to see me when they're like 5 or 6 years old, right? And it's like this kind of wonderful focus of preventative practice, but also nurturing that gut microbiome early on to prevent, this pelvic floor issue, the issues with constipation and having to go on Miralax or other, laxatives that children just aren't really supported to take long term that I'm seeing. So I really appreciate it.
Great. And I guess I'm curious, how do you plan to use it for your patients or your clients? Are you planning to just send them to Tiny Health, say with your code so that we know who your patients are, or are you planning to buy it for them on their behalf?
Yeah, so that was another question. Like I thought maybe you guys would go into the different ways that you're, having partners or affiliates or how that whole program works. I'm open to whatever is easiest for the patient. I can surely purchase it for them and then provide it, or they can go directly to you with a link that I have. I mean, I'm open to those options.
Mm-hmm.
Yeah, I'm here for the same information, and I'm also open to both options as well.
Mm-hmm. And Sarah, you too?
Yes.
Okay. Taylor, you want to talk a bit about that?
Yeah, so this is something that we are sort of launching now because we've realized that there is such a powerful partnership opportunity here. And we want to empower practitioners to, incorporate this into the work that they currently do, or to have it be something that we do our interpretation and provide our results and, either send people to us and then they sort of bring the results back to you, or building it part of your practice. And I think it's something that we want to work with you guys to figure out the best way to do, either or both of those avenues. And so sort of the vision that we have right now, and I want any feedback or, ideas that you have, please share. But we would love to provide our practitioners with a $20 coupon code off of the kit price. And this is, something that if you order for your patients, you can use the discount code yourself. And then if you have, like, some practitioners have sort of a bundle that they do, if they work with like kind of a program based approach to their patient care, or you can give that discount code directly to your patients and they can use it. So with the discount code, it's pretty flexible in terms of if you build that into your total cost or if you just pass that off to your patients. And then we want to be able to provide free support. Our goal with Tiny Health is when individuals come to us that they are able to get their results. They get a expert review note. This has actually been updated a little bit since this one, that has a summary that really, is sort of a personal interpretation of their action plan. They have a personalized action plan and there's an offer for them to consult. So our goal is for individuals to be able to look at their results and understand what they are able to do, like what we recommend doing. However, we want to make sure that if you are having this conversation with your patients, rather than them doing a consult with us, or if we want to make sure that you feel like you have a place to get all of your questions answered. And so we provide free support on your patient results. We can email if we want to have a Zoom chat. Let's say you get 5 results in and you have a couple of questions about them. We can sit down and kind of make sure your questions are answered. And so we want to make sure that you don't feel like we're just providing you with these results and you don't have a place to get your questions answered. So that's another part of our practitioner program. And then if you're someone who likes to promote on social media, I think we love having conversations with people in this type of health space. And the 3 of you, all have shared missions, but also approach them in slightly different ways. And it's really fun for us and for our audience to see these conversations that we have about how Tiny Health can play a role in the type of work you do and educating people about the type of work you do. And so being able to do some partnerships on like Instagram and Instagram lives would be something that we would love to offer. A couple things in development would be a practitioner portal. So if you are someone who wants to order the test for your patients, have all of them in one, be able to look at their results in sort of one portal, we would love to be able to create something like that. That's in development, sort of on the order of months. And then we also, I am working on developing educational content. I think that's a theme I've sort of heard throughout this of, you guys are all experts in the work that you do, and we want to help bring that microbiome, like whatever areas we can help educate into the work. And we would love to host webinars where, one, it also helps build community between like-minded providers, such as yourselves. So live webinars, recordings, and I hear some interest in being able to educate parents. So that's actually something that I've just taken note of, that if we could, eventually think about providing educational material for parents. We already do a lot of education through our communication. So if we could share that with you to share with your patients. And then ultimately down the road, if bulk pricing is something that's ever of interest, having kits on hand, if that's the type of practice that you're doing, is, again, something, these are all in development ideas. So I would love to hear sort of if there's any things that are not currently being addressed in terms of your interest or needs, if there's any particular areas of this that are the most exciting. Yeah, what are your thoughts?
I'll go ahead and, and share, because I'm like so excited about this. I'm like, I have a kid that's coming in today that I would love to just send your way. But the thing that I'm super excited about is your free support on patient results, because to be honest, like, I'm not the expert in gut microbiome, and number two, I don't have the time, right? So like, I have to do this stuff in my sessions, and that's what they're here for. And I would just love to have that other piece where parents would get the results, and your team of providers or whoever is on your team to help support the patient and be able to go over the results and the next best steps. And then for me, just to monitor, right? Like, okay, you're going to do this test this time. Let's follow up based on what your team at Tiny Health recommends, like, maybe a month or a couple months down the road, the baby's like just 5 weeks old, and let's do another test whenever. Like, I'm just making this up, but kind of that scenario where I'm facilitating the resource, and I'm saying, here it is, here's what it entails, this is why it's important, this is why I think it could be good for your child, and then you guys do your magic on your side. I think that is a really wonderful way that I see this working for my specific practice setting. And then obviously, like, the promotional partnerships, like being able to tell other people about it, like other therapists, other, functional medicine docs, like, because they're going to a different company for, their testing, and maybe they don't know about your company, obviously, because it's new. And I think the biggest piece of it is that you are specifically focused on infants and, children. I mean, that's not really marketed out there, right? And when I'm looking at, for me right now, a lot of the kids that I'm seeing, I would love to do the gut testing, but like I said, it was like so expensive. And the age range, they were like, no, we can't do that. Like, some of the tests were like not appropriate for children as young as, a couple weeks old or whatever they were saying. And then the other piece of it was the what was it? The ability for the parents to like follow through with some of it. And food sensitivities is what I'm seeing huge. So like in the pelvic health world, we go through what's called urotherapy first, where we're doing like more conservative approaches. So we're looking at diet, we're looking at lifestyle, we're looking at how the neuromuscular system works, and we're looking at all these things. And then lastly, when I've like ticked off all the boxes and we're like, oh, we've done all this, and then it's like the food sensitivity panel testing or allergies, and then gut health or the gut microbiome. And usually, and I'm like, now talking with you guys, it's like, it should be switched. Like, that should actually be probably the first things that they're getting before they come to see me, because what I'm going to do is not going to be helping all that they need more support with. So it's like, my mind is just spinning like, before they come to see me, let's do this stuff first, because if that stuff gets managed and they come to see me, maybe it's less severe, their symptoms, or they don't even need to see me, right? So it's like, I'm so excited. I'm like, yay, like there's something that I can offer these parents that are just like, oh my gosh, what do I do? Or I'm so frightened because it's my second or third child, and my older ones have all these issues, food sensitivity, eczema, asthma, constipation. Like, I want to do something so this kid doesn't have that. So this would be like wonderful.
Yeah, that's great. So a couple of things here. Yeah, I mean, the stool test is such a non-invasive. My daughter just went through a blood draw for her, like, allergy thingy, and it was a nightmare getting blood from a toddler. Gosh. So yeah, this is sort of a very non-invasive test. And then also our retail price per kit right now is $199. And so with the $20 kind of coupon, again, whichever way you want to pass it on, as Taylor mentioned, or you want to take it as part of your program fee or whatever it is, it's $179. We also now, as a new thing, have an option for you to expedite results, because it does take, with our current system, our current lab, about 4 to 6 weeks. We're trying to optimize that between sort of the 4-week mark and not exceeding that, hopefully. There is an extra $100 kind of expedited processing fee to reduce that time to 2 to 3 weeks. Again, kind of when we say 4 to 6 weeks and 2 to 3 weeks is kind of conservative. We're actually adding on a week there as a buffer. So, it could get down to 1 to 2 weeks in the expedited mode. So I know, like, especially when you have patients and they come to you with urgency, they want results like right now. And that's the thing with metagenomics, is it does take a longer time, but there is an option to expedite. We don't make any money from it. It's just a pass on fee. But we've heard from some practitioners that in their first visit, they want to basically book, they wanted the patients to take the test, and they want to review the results with the patient in the first visit. So, and some practitioners or patients are willing to pay for that. So I just wanted you to know that is a new option now.
Wonderful. And then another question I had was, do you have resources like evidence-based articles or research papers that are supporting some of the processes by which you're doing that? Because a lot of the patients that I have, their parents are very well educated and knowledge and resourced. I'm in the Silicon Valley. I mean, that's where I started my practice. And if you can imagine some of those engineers and people, how their mind really works, and they want to see that, like, I want to read this kind of study and tell me why this is going to be helpful. and that could be really wonderful to share it with them.
And yeah, this part some people may miss if they don't click into read. It's a lot of stuff, and we're trying to reduce that.
Okay.
But everything that we mention here are cited. And even in every single key insight, we link to papers. And then in the action plan on the right, like if we were to recommend maybe this one, yeah, like, any sort of even natural remedies, it's a struggle to find evidence. Like, for example, if the child has high strep, garlic, like who's funding a garlic study, right? That's free. So, but we found one paper, so everything is scientifically referenced. We try our best. And then we are actually publishing a white paper. So if you go back to key insights, Taylor, all these sections, all these antibiotic resistance signature, immune strength, diversity, all these, we are publishing a 17-page long white paper, and you will see it on next Monday.
That is amazing. Congratulations, because that's such a feat. And that's like something too that I was wondering, do you guys, maybe this is later down the line as your, different programs become developed, but are you going to have research opportunities for practitioners?
That is another thing, you're like perfect segue into it. We are going to be launching our first research edition kit. We're still trying to figure out the IRB approval, so the ethics board approval. But October 16 is not food allergy, just any allergy, World Allergy Awareness Day. And so we partnered with Sarah, Dr. Thrill is our primary partner for this. we are launching a study with her because there are just so many allergies, and I'm talking about milk protein allergy, soy protein allergy, like sensitivity to mom's breast milk, that is literally a black box right now. There's just so little research. Even the ones that are featured in our conditions section, these are IgE immune mediated food allergy, which is more connected to eczema and asthma. But the other types, you know, the non-immune mediated and all these like EOE, FPIs and things like that are not well studied, especially with microbiome connections. So we are launching that research edition kit. Kiara, and for your constipated kids, we may have future collaboration that we're talking about for constipation specific research collaborations. So yeah, there will be an option where the parent, then this, I think the allergy one, we want the parent, the mom baby connection actually. So we encourage the mom and the baby to both submit their samples, and they will have to purchase the kit too, but opt into the consent form for research.
Wow, that's wonderful. Yes, I can't wait for you to do constipation, because I will have subjects for you for sure.
That's great. And yeah, if you guys are in sort of our practitioner kind of mailing list and networking, we'll make sure to add you to it. I think right now, because we have an affiliate, like a influencer program, and the practitioner program is new, frankly, and this is all under development, as Taylor has shared. We may put you into that same influencer kind of mailing list when this comes out, when we have new announcements, so that you can also share with your community and kind of keep in touch with what's going on. You can sign up in a regular newsletter as a user as well. But I think like we would love to hear from practitioners, because we are newly working with more and more practitioners now. What symptoms, conditions you're treating, you're seeing? Are our insights helpful? Which parts kind of like in your clinical practice or your own practice, like, you know, kind of, you know, is it kind of aligned? What are you looking for? Because we are coming out with new insights constantly, and also action plans, right? For example, eczema. We have a lot of requests for histamine biomarkers, histamine indicators, because we know that eczema babies or kids don't do, like some of them, you know, it might serve them well, reduce their symptoms if they go on a low histamine diet. So in, I think October, by end of October, we are coming out with the histamine sort of species proxy. So that would be helpful. And that's what we learned from a practitioner. So if you have things like that, that you can kind of, you know, keep sharing with us, it would be helpful as we continue to develop and add more stuff. Like we're adding constipation. We just added colic as a biomarker, so we can detect microbes connected to colic, which is a huge thing. Constipation is next. We have other things for moms, even during pregnancy, like gestational diabetes, early detection, preterm labor. So even for mom, we have them. But for babies, there are like sleep issues coming up. There's conditions like type 1 diabetes in the future, all kinds of stuff. Even autism is a little bit more of a black box still, but there are associations, just non-directional, you know. And then it was interesting too, because I was chatting with an eczema specialist to a practitioner, that she was like thinking that lactobacillus should be detected in a baby's gut or an adult gut. And so actually our scientific team did, you know, like we couldn't find any paper using metagenomics that found that lactobacillus is should be colonizing a baby's gut. They're typically colonized in the small intestines, not the large intestines. So we don't really see that. But there are a subset of practitioners who think that we should be detecting them. If we don't, the gut is dysbiotic. So this is not true. We've managed to dispel this in a way where it is a healthy debate between us and a practitioner, and maybe some education or re-education going on here, where, you know, we're like, we want to make sure what we're saying is also true. So we kind of like, if 3 practitioners treating eczema are telling us they're looking for lactobacillus, are we missing something? You know, we're asking them to share papers with us. And then those papers that they shared with us are either culture-based or, you know, some other technology where, yeah, if you culture and try to find lactobacillus, you may find one, but it may not be may not represent like, you know, it shouldn't be a kind of what do you call in the gut. You wouldn't expect to find it in large quantities. If you culture it, sure, you might find traces of it, right? Detection of, but it's not going to show up in metagenomics because maybe it's like 0.00001% of the community. So she was like mind blown, like, oh, like didn't realize that it's supposed to be colonizing the upper tract, not the lower tract. So it's okay. It, like, again, lactobacillus-based probiotics can give the baby a transient effect. Like Lactobacillus uteri helps with colic, and Lactobacillus rhamnosus helps with eczema, but you're never going to see it, not never, but you're rarely going to see it colonizing the baby's gut. But it also means it's not going to change the community. So if you have really unfriendly bacteria in the baby's gut, Lactobacillus manages symptoms, they're not going to change the community. Bifidobacteria-based probiotics can, and that's kind of why there's a little bit of re-education even between us and practitioners that we'd like to continue, because this stuff is all very new in the past really 5 to 10 years. And Tiny Health hopes to play this role of, you know, continuing to educate.
Yeah, we have a whole team of scientists that get to stay up on all the like late breaking research and, you know, really look at all the papers together. And, you know, when you're working with your patients, a lot of your time and energy, I mean, your appointments are never long enough and there's so much to do. So that's one of the things that we hope to provide is, you know, being able to compile so much information and bring that to our practitioners in a digestible way, and educational modules, and really it be a two-way street again with that support. If there's something that you have, you know, that you think in your practices is important, and it's something we're not commenting on or say something slightly different on, that's a conversation we would love to have.
I just realized we're at 11. So yeah, any other like final comments?
Yeah, just one last question. For clients right now, what would be the best way to refer them or to work with you? Should I have them order it directly from your site or what?
Yeah, I think it's easiest, right? Unless you're kind of like having patients locally visiting your clinic or whatnot. We just drop ship. You know, it's the shipping fees included in the price of the kit. So what we can do, if you've all filled out the practitioner request form, which I think all of you have, right? Then I think Taylor will work with Megan to issue the coupon codes for all of you. And you can start using it however you want to.
Yeah, and then at this point, until we get a portal launched, we just encourage you to ask your patients to share their login information with you, so that if you want to review their report as well, like prior to them coming into the office, you have like a little bit of time to prepare. Or there is a print option. And so again, this loses, it prints out, you know, their key insights, their personalized note, their breakdown. Once you print it, you lose the ability to do all of the amazing, like find all the information that's embedded in here. And so that is one downfall with the printing, but that is another option.
Another question I had was, is there any materials to send to, like brochures that you send to people to have in their clinic or their practice so they can see, you know, something about it?
Yes, please.
Cool. That would be a request that I can think about working on. No brochures yet, but we have these little postcards, you know, that it's just like a very simple flyer
perfect.
with like a coupon, with like a $10 coupon code. So it's less than what you offer probably, but I can send you a pack if you want.
Yeah, I would love it. I would love it. Because some, you know, parents just like having a physical material thing, and then it just directs them obviously to your website where they are able to like read about it and that sort of thing, which is really nice. Okay,
yeah, I can you can maybe email us. I think you can just do hello at Tiny Health, or Cheryl at Taylor at, you know, it's all our first names.
Okay.
And then tell me how many you want and I'll send it to you.
Oh, wonderful. Thanks, Cheryl.
Awesome.
You had mentioned about how long the turnaround is. How long does it take like, did you say to drop ship if we were to order in bulk?
In bulk, to your office?
Yeah.
I mean, same amount of time. I think just USPS regular mail. So typically it's we pack really quickly. So if you order today, we'll like ship it out tomorrow, frankly, and you get it in a couple of days. The
Okay.
same week. It's really quick.
Okay, because I feel like I don't know. I mean, I do a lot of like, I have like essentially like an apothecary in my office, but I feel like it would be really helpful to just be like, here's the box, and this is something that you can consider. I think it would encourage people to move forward with it, because like the last couple of people that I've suggested, I'm like, go here. And then it's almost seems like it's a little overwhelming. And so it's nice to know that like eventually you'll have a practitioner portal, or, you know, to be able to kind of figure out how to navigate that, because they're coming to me and they're wanting answers. And then for me to be like, let me just push you off. I feel like I'm just kind of pushing them off into like somebody else. And while I don't really know a lot about this, I feel like at least then we'll have kind of a starting place to go from. And then, and I really like that in your portal, like at the bottom, it says, if you want to hire these people, then you know, if they're feeling like drawn to do that, then that's something that they can do. Like, I think the whole model works really well for me. I'm just trying to figure out how to actually place something in their hand where they feel like, because like you said, most people are really anxious and want something that day. And it'd be nice to be like, here's this box, or here's this thing, let me help you. We'll just test it together. Let's just do this right now and send it off and be like, you know, in 2 to 3 weeks ish, we have some results. Let's reschedule you after you get your stuff back. And I feel like otherwise, like I said, when I think it's great. I'm just trying to figure out how to get people to actually pull the trigger. And if I was holding it physically, that might be more beneficial for my population. You know,
removing the activation energy required to go to the website, sign up for the kit, get the kit. When I got my kit, it still took me a couple of days to actually do the sample, and I work here. So I totally know that the activation energy is a real thing. That's a great point.
We can definitely just, if you want to buy 10 kits, we can even think about offering a discount. We haven't figured all that out yet. Again, you'll be like, you know, I think a couple of people have asked, like even our advisor, he's a pediatrician in LA, he's asked for 10 kits. So we're going to send it to him. So yeah, like we can definitely do that and see how it goes.
Okay, cool. Yeah, because I do feel like that would help eliminate some of the barrier to getting these kits in people's hands. And also, I don't know, sometimes this is really I'm just pretty confident that this is the answer, where we just need, and I told one of the moms who was like, well, you can keep doing what you're doing, but we're shooting in the dark. I would like to have something that's on paper. Okay, so I was going to ask you this other thing. When you go into the portal, and I can't see the screen anymore, is those options for like suggested things, are those kind of like an auto-generated sort of situation? Or would I need to come back to you and go, okay, here, my patient got this kit back. Can you help me explain what it is? So, I mean, because the education portion is going to be huge for me.
Yeah.
And I can always like highlight on these key things, like, okay, so now I know a little bit more about lactobacillus, but I can already tell I'm going to end up doing this on myself and running through every single one of the little things and learning as much as I can about it, and all your hyperlinks and all this stuff. But are the suggestions, are they already there for them? And then we're just kind of reviewing them. Is that kind of how you have this set up?
Correct. Yeah.
Yeah.
I mean, automated but personalized according to what taxa, what bacteria is deficient, right? Yeah. So these are they're all super personalized.
Okay. And then in addition, for we generate notes for expert review notes for all of the samples. And we do clarify in there, like, you are taking this probiotic, we do think that it's beneficial to continue, or based on your results, you could consider stopping and resampling in a month to make sure the gut community still looks as good as it does now. So we do offer a little bit more personalized insight in that expert review. That is not necessary in order to be able to interpret the action plan. But that is something that, at least for like our individual customers, we do offer right now, just to provide that a little bit more granularity. But especially for our practitioners who, you know, what probiotic your patients are taking, and you can do some of that expert. I mean, you guys are experts, so you can also help do some of that expert review. We have the expertise in like the microbiome specifically and providing those insights. But that is an additional layer that we offer to our individual customers at this time. And this type of thing that we could, you know, if you wanted support on, we could chat about how we approach recommendations around starting or stopping or switching products. But yes, our goal is that through the action plan, you should be able to understand the next steps.
Okay. Can I ask a question? When a client gets their results back, do you do a call with them as well, or do they just get everything on their account?
Everything is on the account.
Okay.
And you know, we have been we've been doing some consult calls, offering them in order to understand if people are through their results getting what the next step should be. And the majority of people do have a good sense of what their main next action is, when they should resample. And the conversation is really, it's just, there's nothing that can replace a human conversation. So sometimes it's nice to answer a couple of those more minute questions, or if things have changed between the sample, that's a great way to have those conversations. We do offer them for a discounted price right now, for $30. That won't always be the price, but we glean so much information from talking with our customers right now that it's very beneficial for us to offer this discounted price and talk to more people. And so that's sort of something we are working on with practitioners, of like, how much would you want to be having that conversation versus if you're using this as more of an adjunct and the microbiome is not necessarily your wheelhouse, would it be beneficial to book a consult with us, or would you want to take, you know, sort of play that role? And I think each practitioner would be different. But I think that is something that, you know, as you start to get results and we would love feedback on sort of how we can make that partnership best work to support your conversations.
Okay. Thank you.
I think it would be really neat when you have the provider portal open, to be able to run like diagnostics on it, as far as like, hey, most of the patient population that I see, I can like click a button and it will pull up that, okay, out of the, I don't know, 30 people that I saw, you know, 50% of them had this sort of thing going on. Like, could I find patterns within the patient microbiome that were specific to each other, and then be able to bring them to you and go, hey, I'm noticing there's this pattern, because I can pull those reports. Then we could talk about like, maybe, you know, I mean, obviously it's just a correlation, but could we do a study based off of that? Because I think that, especially with what I'm doing, right, exactly, Kira. I think that, to me, it'd be really nice. I know that's like a whole nother layer to what maybe you'd be building, but there's this part of science is so new and so neat. And I think that's so much bigger than we realize, that even the patients that I have, like that have, you know, a vagus nerve dysregulation, or that have, you know, like lip and tongue ties and stuff like that. It's like, you might not be able to necessarily tie it to what this is, but I know that it's related somehow.
Right. And so this is where the research edition kits kind of come in. The thing about research is that, yes, we have this mountain of data now, frankly, but we can't publish it unless it goes through an IRB review or process, you know, so they have to look at our protocols, our methods, and all that. There's a governing board for research publication. So yes, we have our internal, and we're constantly doing, frankly, internal data science and analysis. And that's why the condition section, even this section is, if you want to click on it, we're continuing to improve the markers for kids. This is actually a living and breathing thing, by the way, like these markers, whether or not it triggers the signature were actually changing like by the month because we're getting more and more data and we're learning, oh gosh, like this is too high or too low. So we are adjusting them. It's just that for publication in a journal, then we need IRB. So that research kit will be the more formal process around this.
And Sarah, one thing we are currently discussing is now that we are getting more and more repeat samples, which is the goal to be able to follow the gut microbiome and how it changes. We are working on how can we best illuminate so right now you can toggle between samples. You can see here, there's no need support for this kiddo at 13 months, whereas at 6 months, they had 3 need support. We're trying to figure, we're actively working on sort of the next phase of how can we highlight that without having to toggle back and forth the changes that have happened over time. You can see if you click into each of the sections, we have really wonderful graphs that show you changes over time as well. So while, you know, the trends amongst all of your patients is something that, you know, potentially long-term down the road, the data science behind that, but immediately now you can see changes in individual patients over time, which at least on, you know, the individual to individual level is really powerful to be able to visually see how things have changed and progressed. And as well as with the microbiome breakdown, being able to see like how that changed over time is really cool.
Yeah, it's really neat.
Well, I want to be respectful. I know that you guys are all so busy and taking an hour plus out of your morning to learn more about Tiny Health. We're so grateful for all your insight and that you guys have heard about us, and we would love to help support the amazing work you're doing for kiddos and families. So just I'll sort of summarize with next steps is that we can generate your individual discount codes that you can use or pass along to your patients. And we will fold you in for now into our affiliates so that you can continue to receive information and educational information, while we also work on how to, you know, target specific information for our practitioners. But we will definitely be in touch.
Thank you so much.
Awesome. Thank you. So great to
Yes.
meet you all. Bye.
Reach out with any questions.